applies here. And the best way to kind of look at it is thinking about what's the probability and the severity of that risk, and therefore what will be the level of the consequence. Will it be a higher level of consequence or a lower level of consequence? In this case, you're going to be looking at the risk of infection. So what is your level of risk the way it stands, and what would you need to do to try and lower that amount of risk? If you don't really do anything to try and lower the risk from where you stand at this time, then things like the risk to the credibility of the business or the risk to financial viability of your business could get affected as well. And so those are things that you want to look at in terms of the consequences of the probability and severity of dealing with the risk of infection. You can kind of think about it in terms of what was normal pre-pandemic and what is considered the new normal post-pandemic, and then kind of go from there. If there are stores that have been open this whole time that now you're not necessarily super comfortable going in them because they're not doing as much as they could, that's sort of the same example that I like to use, is that you're not necessarily going to those places anymore because you don't feel it's safe. So you want to make sure that that is something that you're sort of putting into the thought of your business when getting ready to reopen. So the next step is control. So this is the pyramid for the hierarchy of controls. We're going to go through each one a little bit just to kind of give some examples of what you can do for each type of control while trying to reopen. When you are taking these measures, just make sure that they're all being done within the compliance of requirements from the Occupational Health and Safety Act, and that you're still following any kind of emergency orders that are made from the Emergency Management and Civil Protection Act, or any public health directives and guidances that are being issued from the Ministry of Health and Ontario's Chief Medical Officer. That will really help make sure that you're kind of keeping up to date with this thing is changing every day, so this will kind of help keep things up to date for as you go with your controls. So the first control would be to try and eliminate the exposure. So what you would want to do is, as much as possible when you're training your staff before they come back to work, you're going to want to try and do it virtually as much as you possibly can. I know that there will be some hands-on training that will probably still be required when it comes to things like getting them used to using specific equipment at your store or at your business. But when it comes to training employees about keeping work surfaces clean or frequently touched equipment clean, or how to wear and maintain their PPE, depending on what it is, and then just how to communicate with customers, those are things you could easily do over the phone, over a Skype chat, something like that, just to keep it the exposure to each other and potentially spreading COVID kind of at bay as much as possible. While eliminating exposure is also another control for when the business is open. These are a couple of things that we've noticed other places have been doing so far, and they're probably the best practices if you can do them. So taking orders electronically and the payments electronically, you can either take someone's credit card information over the phone or have them order online from your website if you have one. Curbside pickup, or the no contact pickups that a lot of hardware stores and stuff have been doing, that's another good way to kind of try to eliminate as much exposure as possible. And then screening employees and customers for COVID. This one gets a little tricky, but essentially there are some self-assessment tools that you can ask certain questions to your employees or even to the customers just to see how they're feeling. And if you think that they might have COVID, then you'll just ask them to not come into the store or to not come in for work until they're feeling better, just to keep those germs at bay as much as possible. The next control would be to separate. So implementing barriers or screens. This is something that we've noticed for cashiers at grocery stores and various other areas. That's something that if you can't keep that 6-foot barrier, having a barrier from a plexiglass or a screen really will at least help minimize the exposure a little bit more that way, especially if you are going to be very customer facing, behind a counter. You may as well just try and see if you can put something in place to keep that barrier. The next control would be to redesign. Now, this one is more just about, try to reconfigure your lineups and the traffic flow in and out of your store. So most of you will probably only have one entrance where people are able to come in and out. So it's not going to be like, at the Loblaws where they have two entrances and they can just make it flow one in, one out. So that's going to be something you're going to want to look at and say, there are some stores I've seen where they'll literally have a lineup out the door. Someone is sort of like a greeter with the hand sanitizer in a bottle ready to go. And they sort of check how many people are going into the shop. And as people leave, then someone who's at the 6-foot mark can then enter into the store without having to have too many people going next to each other too closely at the same time, and keeping it fairly, I don't want to say sparse, but minimize the amount of people in the store at one time as well. Adding sanitizing stations, whether it's the greeter at the door or just sanitizing stations once you walk in. There's hand sanitizer for people to use, hand sanitizer for the staff to use in various areas of the store or the business. That's a really good one, making sure people keep washing their hands or at least sanitizing as much as possible. Additional garbage cans, that's for being able to dispose of the PPE that either your staff is using or that customers are using when they're coming into your place of business. They're going to want to dispose of it once they leave. So having a garbage can to deal with that additional garbage will be handy. And then debit and credit tap capability. This is something that I'm noticing a lot of places are doing, where if they didn't have tap capability to begin with, they're getting it. And if they had it, but it was at a certain limit, they have decided to up the limit so that people don't have to use the buttons as much. And it can be a little bit more contactless, so to speak, to help with that kind of side of things. Next, it's going to be the administrative side of controls. So for your health and safety policy, just the general health and safety policy, I don't see you needing to necessarily update that one too much, because it is a very generic statement. But you will want to look at other policies that you have in your program for things like safe work procedures, including wording about physical distancing, where it's possible workers are going to be, encouraged to keep 2 meters apart. Try not to pack anything in reusable bags. Cleaning practices and frequency. So when there are countertops or pieces of equipment that are frequently being touched, how often are you going to be cleaning those, and what are you going to use to clean those in order to really try and get a good clean on them. PPE requirements, the supply and the replacement of them, and what is going to be required as PPE in your place of business. Those are going to be things that you're going to want to try and update in your policies. First aid and emergency response. So there will still potentially be accidents happening in the workplace. Unfortunately, it's just the way things go. And so with that, and with the added kind of stressor or hazard of the pandemic, you're going to want to make sure that you have, maybe there might be some additional things or some different protocols that you need to take in order to take care of the person that's been hurt, to try and also mitigate the risk of getting COVID as well. So you're going to want to maybe talk to your first aid provider, see if they have any suggestions or new protocols in place. And then workplace harassment is the other thing that you may not need to necessarily update it, but it might be a good time to do a refresher with your staff on how to deal with workplace harassment. People are getting really agitated these days. It's hard to tell what they might do. So kind of go through the motions of what your policies say to do, and talk to them about, this is how you try to, what's the word I'm looking for? This is the way that you try to kind of, decrease the amount of agitation in a customer that's there. If it's not working, then just come get a manager, and the manager can deal with it, that sort of thing. So just a good time to review it, to try and help out your workers so that they don't end up in an unsafe situation. So human resources policies are also going to need to be potentially updated, just to add things about screening processes. So as we mentioned, the self-assessment to screen whether someone is feeling sick or not. Isolation policies or returning to work, and then medical privacy. So medical privacy is going to be a tricky one, because typically you're not really supposed to tell other people's business about their medical records. But in this situation, it's one of those things where you have to kind of figure out where's the line between, am I making sure that everyone is staying safe, knowing that they need to maybe, do some self-isolating if there was a case of COVID that got found out, or, how do I do that without stepping over the privacy kind of legislation. Scheduling and signage are going to be big things to consider for administrative controls. So office hours or store hours, are you going to shorten them? Are you going to lengthen them? Are you going to switch them around so that they start a bit earlier and then end a bit earlier? And then also with staffing, you're going to want to stagger any breaks or lunch times. I also kind of think that staff being staggered to come in and out of the workplace is probably a good way to maybe look into if that's viable for you. That way you don't have all your staff in one spot at the same time. You can maybe stagger their almost like shift work to make sure that they're not all in one big spot kind of convening all the time. Cleaning and sanitizing is going to be another thing for the scheduling piece. You're going to want to say, how often are we cleaning? What are we cleaning? And like, how does that work for the scheduling? Are you going to wait for, slower times of the day versus the high peak hours of your business time to try and do some of the cleaning? How is that going to work? For signage, you're going to want some signage about physical distancing, just little reminders about hand washing or hand sanitizing. Signage about harassment to say, this kind of behavior will not be tolerated, that kind of thing. And shirts, this is for if you have almost like a uniform where you provide shirts to your staff, maybe think about adding an extra one in for them just so that they don't have to do the laundry quite as much, because washing clothes is going to be a big piece of trying to keep things sanitized. Also, I've seen places where they didn't typically have shirts, but now they have ones just to promote the physical distancing aspect. You might want to consider it if that's something that's viable for you. Hygiene is going to be the next administrative thing. So just again, we tend to get complacent about this stuff like hand washing or hand sanitizing. So just trying to remind everybody, again, this is where the signage kind of comes in really handy. If they see the signs everywhere, then it'll keep it in their minds they have to wash their hands after each, use of something or another. So just keeping that in mind. Remembering proper protocols for coughing and sneezing, sneeze into your arm or use a tissue and throw it out right away, wash your hands right after. Again, like I mentioned before, the washing of the clothes is going to be really big so that you're not, bringing the bacteria in and out constantly of the store and to home, those sort of things. Resources is the final, I believe, administrative control. So just trying to keep some phone numbers and some links to websites available for any questions or concerns that your staff end up having as you go along. ThinkMentalHealth.ca is a really good one for any kind of resources or information you want about how to deal with the mental health of a staff member if they're going through a tough time, kind of how to deal with that. The Health Unit, Health Canada, your township bylaws, those would be good places to call and find out kind of their protocols. Or what they're suggesting to do at this time. And then the police were saying, Matt, just to have them sort of on call, so to speak, in case some sort of a workplace harassment issue arises and you need to call on them because it's gotten out of hand. The final control will be PPE. So this is going to be a big one. Face masks or face coverings is going to be something you're going to want to look into. You don't necessarily need an N95 respirator. It depends on what kind of work you're doing. If you're customer facing, working at the cash, and you don't necessarily have a barrier like we talked about earlier, a face covering might be a better option, but it doesn't have to be a full-on respirator for that to work. For your hands, you're going to want to get gloves. The body, you'll want maybe some aprons to try and protect the clothing a little bit. And then just make sure that you have PPE training for your staff about how to use the PPE, how to care for it and clean it, replacement requirements and the limitations of that PPE. For example, again, with the face coverings, a face covering will only do so much versus a respirator, which will be a little bit more heavy duty, but again, it'll depend on what you're doing to decide which one is more appropriate for that job or task. For the PPE, last week Ford announced that on the Ontario.ca website, they do have a supplier directory. So I've added the link at the bottom of this slide. You just have to go to ontario.ca/PPE, and that will take you to the supplier directory to be able to see where you can get the PPE from. And then the final stage of the RACE model that we're going through is to evaluate. So you will want to evaluate the effectiveness of the preventative measures that you put in place, because this is something that's changing daily, and you know what's being suggested is changing on a daily basis. You will want to kind of look into this and evaluate and make adjustments or improvements as you go. And just make sure that you communicate these changes or adjustments with your staff and with your customers as it comes. Inspectors from the Ministry of Labor, and they've changed their name now. I'm just going to call them Ministry of Labor right now because it's too long to remember, but they will be coming in from time to time, and if they do, some of the things that they will be focusing in on will be COVID related. So they'll be looking at how many workers are working at one time. What kind of screening are you doing to prevent workers from coming in when they have if they have COVID, policies and procedures that are in place to ensure that workers with symptoms are not coming into work, how you might be ensuring physical distancing between the workers, and how you're ensuring proper on-site hygiene. So again, the signage and having you know, stations available for sanitizing. Soap and water is really the best bet for cleaning your hands, but if you can't do that, at least have some alcohol-based hand sanitizer. And then any kind of precautions, including the use of PPE, will be something else that they look at. They will also still be looking to enforce the regular kind of everyday health and safety regulations. So still keep up with your Health and Safety Act and industrial regulation requirements. Make sure that your staff has done their health and safety awareness training. That is a free training that Ministry of Labor has on their website. WSPS also has a link to it if you're on our Small Business Center and you want to go and check out the awareness training to make sure that your staff are doing it. We have a link to take you straight there, so you're not going through a bunch of different websites back and forth. They're going to want to look at WMIS training, machine guarding, safe work practices. They will make sure that you have a health and safety representative, or if you have over 20 people, a joint health and safety committee, and that you're still doing your monthly inspections of your workplace, and any other kind of, you know, legal requirements that might apply to your business. They will still be kind of checking for those and enforcing them. So just something to keep in mind. As far as resources, I did mention earlier that WSPS has some. So some of the ones that we have specific to COVID are a return to business checklist, a post-pandemic business playbook, the visitor screening questionnaires. There's the health and safety self-assessment for your customers or for your staff to kind of see how they're feeling and assess whether they are, you know, healthy enough to kind of come in to work or into the business. And then COVID-19 health and safety guidance documents. These sort of give you an overview and some best practices of what to kind of look into for your business as you go forward. The final thing that we have available right now is the duty consultant. We've extended our hours, so they are available for 12 hours a day from 7 a.m. to 7 p.m. You can reach them at the phone number or via the email address listed on the slide, and they will answer all your questions. It doesn't have to be COVID related. It can just be other health and safety questions that you have, but depending on what you're concerned about at this time, feel free to call them and they will answer your questions and try and help you out. So that's it for the actual presentation. I'm just going to get out of this and then we will go to questions if there were any questions while I was talking.
Yeah, we've got, great, Vicki. We've got one question here from John.
Okay.
And I'm going to read out, and then I've got a couple of comments too, just my experiences this past week. So John's asking, are you familiar with any work refusal decisions in Ontario where the complainant feels that the control mechanisms in place are not sufficient to what the person may want to see? An example is N95 mask when the employer determines that they are not necessary for the tasks. So I was going to say that the only the work refusals that we've been learning about lately, they're primarily coming from healthcare. So John, I'm not sure if you're in that industry or not. And from what we understand, the majority of them are actually not being permitted or allowed by the Ministry of Labor. They've determined that there's not an immediate risk for the nature of the work refusal that came in. So I don't have a specific example to what you're asking, but what I would do, what I would say is that the best thing any business can do is document. So if you have, and I think I'm trying to getting the essence of this, if not, feel free to unmute and jump in. But if you do have a worker who's saying, look, I'm refusing work because I believe, you know, I should be given an N95 mask in this situation, but the employer is saying, no, I've done the risk assessment. So I've looked at the hazard, I've assessed it, and I've determined the appropriate control based on what the legislation says, what the best practice says, you know, what we're hearing from the government. And I've determined that N95 is not appropriate. So by documenting that process, which Vicki just went through, one, that helps you communicate really clearly with that worker as to why your decision is not supporting an N95. And secondly, if the worker does choose to issue a work refusal, you've gone through the process of talking to them, can't come to an agreement. During that time, you reassign the worker to duties where possible. Wait for the Ministry of Labor to respond. But when you can either talk to the Ministry of Labor on the phone or show them if they come in that you've actually gone through this risk assessment, you've shared it with the worker, that will pay off in spades in regards to helping support your decisions. And that's where the Ministry of Labor then is able to say, okay, I see you've gone through that process and thought about it. However, you know, if you as the employer are incorrect, they're able to point to legislation, a regulation perhaps that would support the worker, or then they're able to say to the worker, you know, your employer has done everything reasonable and their decision stands. So that's how the process goes. So a long answer to your question that no, I don't have a specific example that we've seen come through on our news releases, but that is the process.
Yes, I'm. If I could just respond here, it's better talking than typing. I'm aware of two situations that involve work refusals, and I know the process well. But I'm wondering, you know, about the ministry's response to those, because at the best of times, the ministry is in between a rock and a hard place. They want to support the worker, they want to respect the process, and obviously enforce the law as applicable. But when you get into a lot of risk assessments, it'll come down to qualitative assessments based on known information. And so what I've seen happen quite a number of times is that the person who is concerned is not necessarily dealing primarily with facts. It's more about the fear of the unknown. And certainly in the case of, like, I feel like my employer should do everything possible for me, and therefore that might include an N95 when otherwise, you know, the qualitative risk assessment wouldn't bear that out typically for jobs that, you know, didn't involve droplets or bodily fluids and that kind of stuff. So that's one situation. Another situation that I've heard of is that if people are actually refusing to come into work just because they feel like being in the workplace is not safe because they're not at home, and they are essentially, it doesn't matter what controls are in place, it's not a specific thing, it's a general, I don't feel like I'm should be in the workplace. So to me, that's outside of the work refusal process, but I don't know because it sort of still is a work refusal.
Yeah. So speaking to the second one, that from what has been explained to us is that is not a work refusal, because the work refusal process applies to imminent danger. So I'm doing a job right now, my health or safety are in jeopardy if this is not controlled immediately. And so if they're calling from home, it's not a work refusal because they're not in the work. Similar to now with the N95, you know, when someone being, you know, afraid of being exposed. So, you know, for everybody else's sake, you know, I'm imagining I'm working and I'm here face to face with customers, let's say, and my fear is that I'm going to be infected. So I need the highest level of protection because I'm working with the general public. So I'm issuing a work refusal. And so my response again is, as you said, of course there may be qualitative, but that's permitted. It's what is that, what's the law, what is best practice out there, and what is reasonable precaution. So we know that all the guidance coming through is telling us that N95s are for the medical frontline workers, you know, medical in the corrections facilities, those kinds of things. And in particular, when they're dealing with somebody who's known to be infected, they're even looking at it to that degree. So for you to, you know, be able to pull on that guidance to make your rationale to the worker and say, look, we've got these other controls in place, you know, whether it be a barrier, if we can't do that, physical distancing. And if not, then the recommendation is if we can't reasonably maintain that 6 feet of physical distancing, a face covering or a face shield, which is, you know, it's a less expensive solution than having the bigger physical barriers. But that is, to me, taking reasonable precaution as an employer. Otherwise, I think where you're heading to and what you were commenting on is that the entire workforce could say, look, I'm not comfortable, you know, I'm just not going to work. So if they choose to do that, you know, that becomes an HR issue then, as opposed to dealing with Ministry of Labor, because again, the government has not issued a decree to say nobody's allowed to go to work, it's too dangerous. They've actually started to say now people can start to go to work as long as you're following what's reasonable as far as the protocols that are coming out. So, okay. You know, again, not a perfect answer, John, I know. Something else I would do just to ease your mind, like if you feel like you're getting resistance from staff members, is to call the Ministry of Labor, like their toll-free number, which is a confidential free call, and they have a duty consultant on. And you can pose this question to them and write it down and say, this is the response that I'm getting directly from the duty consultant, and use that as well as part of your evidence to the worker in that regard. And then unfortunately, we know worst case being that you have to, you know, involve the ministry to come in, meaning worst case that, you know, their time and wait for them to come. Again, you've done your due diligence, and sometimes we need to leave it to them to make that decision.
Okay, thank you very much.
Okay, yeah, and again, I hope we've answered that in some way. It is challenging times, but definitely saying I'm not coming in and I'm refusing does not fall in that definition of work refusal. Hazard's got to be right there, imminent, and a danger to health and safety that needs to be controlled immediately, or the perception that it needs to be controlled, because the worker isn't always right. Sometimes it's just their belief that something else needs to be done, but the law in fact supports the employer. What else I wanted to mention is that just a couple of experiences I had this week, Vicki. So yesterday at the grocery store, it was interesting to be out and you know, see a mixture of people wearing face coverings and some not. But there was an older gentleman at the cash lined up, and he was starting to give the employees grief because at the lineup there were people sort of keeping us, you know, our 6 feet apart and directing the traffic. But at the other end, where people were bagging and getting ready to leave, it was starting to bunch up just a little bit. And so this man was almost pacing back and forth and starting to, you know, loudly comment, well, how come you're not over there at the end making sure there's a distance? How about when I'm down there, you're not? So you could see it escalating a bit. So after he lined up at the next one behind me, I casually mentioned, well, you could wear a face covering as well. And he didn't have one on. And his response was, well, my doctor told me that they don't do anything. It's not going to help me. And I left it at that, but you could kind of hear him mumbling and rumbling on. So it was more of that reminder that, again, harassment is a possibility and a likelihood for your frontline workers. And so anticipating what types of things people might say, what types of complaints they might have, and arming your frontline staff with the language of how to de-escalate people, some tips and strategies just to keep everybody calm and respond, but also reminding them that, look, if it's getting uncomfortable in any way, absolutely reach out to me as the manager, call me over, I'll come and deal with this. And Vicki also mentioned, putting up signage. So there's nothing wrong with sticking it on your front door, about being respectful, that these are trying times. We'll work through this, but we absolutely do not permit harassment of any kind in our workplace. So be considerate of that. So again, it's very real. It's happening. And the other experience I had is just a good conversation with a store in my downtown, a small business. And he's opening up again, and he had opened for one day and then closed because his staff were very stressed out, just with the volume of people who wanted to come in, and they were getting really confused about things like, again, how many people can be in the store? Is the person allowed to walk through the store themselves? They sell clothing, so somebody had tried on a coat and then put it back on the rack, and the employee was, kind of freaking out of, you can't do that, you're contaminating it. And then what about when somebody buys something, if someone else has already tried it on? So it's very real, the stress piece for your workers. And so emphasizing, again, sharing this information with them about the best practices. Vicki referenced some checklists on the WSPS site for getting back to work that you can use, having your staff look at them, give some feedback and input so that they feel a little bit more in control of the situation. And also, again, like John said, having those conversations with them about appropriate PPE. COVID, the only way to guarantee that they 100% won't be exposed to it is for them to stay home and not let anybody in the house, not let any food from the outside in the house, unless the food's been sitting outside for 72 hours, right? So that's the absolute zero risk. After that, you're exposed to potential risk for COVID. There's no doubt about it. It just comes down to how can we keep that risk as low as possible. So in the workplace, again, it's taking those strategies. So the gentleman I chatted with the other morning is, saying, okay, do they have PPE? Do you have a barrier up? As far as people walking through the store, you could have the option of escorting somebody through the store. If they want to look at something, your staff member takes it off and shows it to them, and they're not touching anything. Or, you could have the option of saying, when somebody purchases something, look, we're in a clothing store, so obviously people are trying things on to make sure it fits. Our recommendation when you take this home, number one, launder it, because we know that, soap kills the bacteria. That's why hand washing is touted so strongly, because it works. So wash it and before you use it. And or if it's an item that you wouldn't normally wash, put it outside in your garage or shed for 72 hours, because again, that is what the health officials are telling us, amount of time to kill that virus. So these are, again, tips and strategies that can help you with just calming down your staff, but also being able to offer a level of service to your customers, that they're looking for, because you want them to spend money and help keep all of our small businesses afloat and thriving. So that's kind of my experience, and I just found it really timely this week to hear this. And your frontline workers, as much as you as business owners definitely bear the weight of the burden during these crazy times, your frontline staff are going to be having some issues and challenges too. So if they can be part of that program, it's going to help everything move along a lot smoother. And Vicki, I sort of rambled on a little bit there. I don't have any other questions that have come through right now, unless anybody on the line wants to unmute.
There is a question about the slides, Vicki and Kiersey. Are you putting them out to me for me to email, or how do you want to handle that?
I can get you a PDF version of the slides. So Kirsty and I will sort that out, and then I can send that to you, and you can forward it on to whoever wants a copy.
Okay, so if you pre-registered folks for this, then I will have your email address because it will be on our website. But if you didn't pre-register, then I might not have your email address. So please send me an email if you do want the slides and I don't have your email, and you can email me at Jeanette, JeanneTTE @lgsbec.com. I'll put it in the message section.
Okay. And I guess that's it. Any other questions?
Nope, I think we're good, Vicki.
Okay, well, if that's it, then I guess that's the end of the session. So thanks so much for joining us, and I hope I answered everything based on the minimal amount of questions. I'm hoping I answered everything easily enough through the presentation. So
thank you, Vicki and Kiersey, for joining us today and providing us with this information. It'll be it'll be a cumbersome, hopefully not so cumbersome, but potentially cumbersome issue. And so the clarity that we have going forward will be very important, that we share it with all of our potential clients and returning clients, and make sure that everybody understands where things stand. So that's really the point, is to be clear and to be as thorough as you can. So thank you for sharing that information.
no problem.
Appreciate everybody dialing in on a Friday morning. And so we wish you success over the weekend, especially. People will be out and about. And, as Vicki has mentioned, if you have any questions, want to talk one-on-one, feel free to reach out to her, and she can connect you with the appropriate person, whether it be myself or duty consultant. But we are happy to take that time with you one-on-one if you want to go through anything.
Yeah. It sounded like you said beauty consultant.
Oh, might need one of those too, right? I think everybody is waiting for the hairdresser to open.
Thank you, ladies.
Have
Thanks
a great
everybody
day.
for joining us.
All right.